Hello and welcome back to Orissapost Live. Since a few months now, we have been reporting a lot about suicides, especially in cases of teenagers and students. World Health Day ahead, today we have with us Dr. Jigyansa, who will help us know about what are the things or the factors that are leading to so many suicide cases in the nation, especially our state, Orissa. Firstly, welcome ma'am, welcome to Orissapost Live, and thank you so much for joining us today. To start the conversation, ma'am, we wanted to know what are the primary factors that makes an individual suicidal. Why are there have been a sharp increase in suicide cases, especially in teenagers and students?
Okay, so if we talk about risk factors in general for any suicide, so there are some risk factors which are static, like for example age, like you correctly mentioned, the youth and the teenagers, they are more vulnerable for suicide. So is the elderly population, more than 60 years. Second is the gender, like for example female gender, they are a bit extremely vulnerable to stress and all that, but males, when they attempt suicide, it actually results in a completed attempt, but female suicide attempts, they usually survive, right? Similarly, we have some patients who have made a past history of suicide attempt, or like maybe they might be dealing with a lot of anxiety and depression, or have a diagnosed clinical psychiatric condition in the past, like any depressive episode or psychosis or maybe phobia. So those kind of disorders, they are more prone. So these are the static factors. But dynamic factors, like you currently mentioned, like the way it happened just before and during COVID. A lot of crisis, a lot of insecurity. We do not know what is in the future. So those kind of things we are not able to adjust. Similarly, for teenagers, exams are a big thing. And the kind of pressure the current generation is going through, considering the 10th and 12th. These days, preparation for IIT and JEE, they start from 8th standard onwards. And obviously, the exam is like after 12th. So it's like a do or die situation for most of the teenagers, because the parents expect a lot, teachers expect a lot, and this small child who is yet to explore the world is put under so much pressure.
Correct.
And there's a limit to which a young adolescent or a youth can take a stress. So maybe the limits of the ability to handle stress is actually going down day by day, because of like increased social media connect and no real world connect. Correct. So maybe they're not able to come back the way we used to before. So maybe that is why a lot of factors are there which is resulting in increasing suicide rates, increasing like feeling lonely. And when someone, or you see someone escaping that stress, and people see suicide attempt or any such kind of a behavior as an escape from the kind of pressure or the pressure cooker that they're in. So that is why maybe a lot of people are resorting to suicide.
So ma'am, as you rightly mentioned, the stress that a student undergoes, during the exams or even after the exams are done, the time to wait for the results, now since we are done with the plus 2 CHSE and CBSE exam and the class 10th as well, so there have been a lot of suicide cases that have been registered in Odisha especially. The students, they took their life, they decided to take their life during the exams or just after the exams. So what do you think, what kind of role do the parents or the professor in the colleges or the teachers in the school, they play to kind of comfort the students or the children, this is not something that you should attempt, and there are other ways to deal with stress. So what is the role of parents and schools and institutions?
Yeah, so you have rightly pointed out, because obviously professionals cannot be everywhere. Correct. And like doctors cannot be everywhere. So parents, teachers, and the person that the child is in primary contact with, they need to understand the deeper implications of appearing exams. So what they exactly can do is, during exams and before exams, once it is done, it is very important to let the child know the child is loved no matter what. Yeah, and results are not conditional. Like suppose a child passes, then only I love you, otherwise you're not my child. And those kind of statements that the parents make, although they do not mean it, but Correct. When they speak it to a child, the child actually thinks that if I don't pass or if I don't score good marks, I don't score a 98%, I don't get into that school or that college, possibly my father will be very ashamed of me. And Correct. They may actually disown me. So this is how a child feels. So it's very important for a parent to tell the child, no matter how you perform, no matter however bad or however good you perform, I'll love you equally.
Correct.
Right? And I am there for you no matter what. I know you did your best, and that is what is important, because trying is important, but the results are not under our control, because a lot of factors we all know
Yeah.
play a very important role in determining where your rank is and how exactly your scores are.
Correct.
So when you talk about stress management and how we deal with exam stress, so during exams and before writing exams, it's important how to like strategize the way you prepare for your exam, the time management and those kind of things. But after exam, it is important to let the child know that exams are only a part of his life, not the entire life. There are a lot of other domains in life that is important, like for example, spending time with family, friends, having a leisure activity, having a hobby, like so that if at all the exam does not go well, the child can actually fall back.
Yeah, correct.
So those are the things that help build resilience in the child. And if at all the exams do not go well, then the child can go back, like play badminton for a week or a month, so that the child is relaxed. And we usually tell before exams what you have not been able to do for a really long time, maybe now is the time to do it after exams. And then they completely feel freshen up, and after the exams results are out, if at all they have done well, very good, prepare for the next step. If at all the results are not that well, like suppose they have not passed, so definitely there is a next time.
Correct.
There is no limit on how many times you can appear an exam. Definitely not in 10th and 12th at least. Maybe UPSC exams and those competitive exams have a limit, but not in 10th and 12th. Life is a lot more than that. So maybe this is where the parents need to tell them there are alternatives, and this is not the only way.
Correct.
You can choose alternatives. Maybe try anything on earth, like try taking a ear drop. That's also fine, because you'll not die by that. At least if you live, maybe you'll have a second chance.
Ma'am, we did talk about the parents' involvement in comforting a child, but what do you have to say about the role of the school, of universities in life? Like we have, while a girl child is growing up, there are classes to explain female students about menstruation or everything. So do you think there should be more classes on mental health awareness, so that it helps them to understand how important it is, and being healthy doesn't mean just being physically but mentally also. So mental illness and being mentally fit are two things that one should consider.
I'm not very sure if you are aware, or a lot of us are aware, but there are some programs related to that called the school mental health program, as a part of which talking about mental health, talking about the various mental health issues like depression, anxiety, stress, having difficulty in sleeping, and particular situations where a person gets exposed to stress. So talking about all that are definite chapters which are there, but obviously I don't think it is incorporated in the curriculum as of today, right? Because we are here talking about it and we did not read about it, so we do not know how it is. So definitely if at all we include that, like maybe an extra activity class or those kind of things which were there earlier. So those classes can actually be used to talk about mental health and to talk about positive coping. And when a person, we do not talk about positive coping, so no one knows what to do if I am stressed, right? Like for example, in the West, they talk about when you are stressed, they give you 4D techniques. Like for example, I am extremely angry now or upset. So what I need to do is the trigger from which I am getting upset. Like for example, you and me had a fight. So definitely looking at you will actually increase my anger a lot. So what I need to do is I need to distance from that stressor for some time. Like for example, if exam is causing me a lot of stress, so I can take a break, like take a break of 5 minutes. Nothing is going to fall if you actually take a break. So distance for some time. The second D is actually take a deep breath. So in our religious practices, this meditation and pranayam, and those are also things which also help you in reducing stress. The third is drink enough water. You're right now feeling stressed, you're almost having a palpitation, you can take a break, drink some water, come back. And the last D is distraction. When we talk about distraction, we ask you to engage in any other activity which is not involving the primary stressor. Like you can talk to a friend, like watch a series on Netflix, listen to some music, and you can choose your music and your playlist, which actually helps you calm down at that point of time, right? So those are the kind of things, if a person knows, I am feeling stressed, I know what to do. So that bucket of lists is available. So that becomes automatic. Instead of thinking of killing yourself or giving up your life, you know what to do.
There is help available, that's what you
that's help available. There are alternative ways of coping
up.
You don't have to actually harm yourself to get better. So maybe those are things, if we make it a normal conversation also, Yeah, maybe schools or we also, like the way you are doing it, this program itself. If people at least talk about it, so that is how it can be normalized.
Ma'am, like although there is need of more such programs, but there has been initiatives at the schools and universities. Even there are parents who have understood kind of, how important it is to comfort our child, talk about them. But what about, like you mentioned, maybe our earlier generation did not know about it. So if like a teenager, if he is exposed to, certain activities or certain initiatives to aware that particular child about mental illness or how to cope up with situation, then we can help that child. But what about the people of the generation who are like 10 years elder to us? They do not know what exactly is happening to them. So how do they seek help and how do they understand kind of what is happening to them?
Yeah, so that's a very pertinent question actually, because children and the youngsters are dependent on parents for, like for everything almost.
Correct.
And in India, almost that does not happen up till 25 that a child is independent, till the child actually gets a job and starts earning. So parents do have a very important role, and when the awareness of parents is lacking, it's very difficult to actually get professional help. That is why what we are doing, because it's easy to access children, youth in schools and colleges. So what we do nowadays, we support something called peer volunteers.
Okay.
And we talk about educating peers, so that you can form a group, have peers, they can go and talk to parents, because we cannot move from home to home and talk to each and every parent. But actually the scenario is changing, because we also see a lot of parents who come with their kids, and some of them are extremely supportive, and they do understand the terms depression, anxiety. They Google it, they read it, and then they say, I think my child is having some anxiety. Aap thoda do some counseling and make the child better. People come and they have been talking about it. Not all, obviously a lot needs to be done, but maybe this is a starting point, and peers can be the substitute till the time parents are more aware.
So, ma'am, are there any incidences that you have come across where the parents have brought their children to you, they may be feeling depressed or they may be suffering from panic attacks, anxiety attacks or suicidal. So, what are the steps that counselor practitioner like you, how do you approach them? How do you try to help those children?
Yeah. So, when a parent gets a kid or the child comes to us on their own, so what we do at first is we do a risk assessment. To see where and how risky is the child right now. Like for example, suicidal ideas, they range from just having a passive death wish, like I wish I was dead, to actually planning and contemplating that after this exam on this particular date at this particular time, I will die by this means. So it can range from just having a fleeting suicidal ideation to a serious
actual thing,
contemplation with a plan.
Okay.
So depending on that and depending on the past risk factors and all that we talk about, so we formulate a risk analysis, and then we triage it into 3. Like one which can be followed up on an OPD basis, someone who needs, like parents have to be told that your child is at risk, you need to keep a watch on your child for almost 24 hours a day, and some people we have to admit them because they are that risky that even we cannot leave them for 1 minute. So once we do a risk analysis, suppose someone is like mild, and that person understands the need for help, and they are willing to come to us regularly and seek sessions. So if needed, and if it is a clinical depression or anxiety, we start with medications. At the same time, we start therapy. Therapy takes some time to start working.
Correct.
So if it is an emergency, we have to start medications, because safety and life of the child is the most valuable thing. We do understand about side effects, and a lot of people are worried about side effects, but if life is not there, where is side effects, right? So first we do that. Counseling involves talking about alternative strategies, giving the child a safety plan. Like for example, suicidal ideation usually comes in waves. Once it comes, then it rises, slowly rises, becomes a peak, then it subsides. That phase of a suicidal ideation, it lasts for 5 to 10 minutes max, or sometimes for hours. So what we do is, during that time, we provide a safety plan so that the youngster can use it at that point of time, know what to do. Like for example, I'll tell you this because this is a group session and all of us need to know that. So there are things that we ask the child to do by on themselves. Some things that they can do by taking help of others. And the last and the most important thing, they're not alone. If they do not have friends, do not have family, they can definitely come to the hospital 24/7. So the things that they can do on your own is like the 4D technique I taught to you about, right? The second strategy is getting a trusted friend or a family member. So we ask them to name the family member, write down the phone number.
Okay.
In case the person is not available, have 3 alternatives.
Okay.
So that that point of time, that person can be contacted, and that person will stay through the entire time the suicidal crisis is high.
Okay.
So that we connect, have someone to ensure safety, and bring the person to the hospital if required. Because once that wave is gone, the person is out of risk.
Yeah.
But when that wave will come, what will trigger, that is difficult. The second is we ask the parents, we give the charge to the parents completely. You have to take responsibility, take charge of medications, take charge of what your child is doing, sleeping or not, because night is also a time where it is risky.
Yeah.
Everyone is sleeping, the child is not able to sleep, so that causes a lot of pain. So we have to educate the parents, empower them. Anti-suicidal measures like like not having those saris and rope and pesticides and phenyl, putting it in locked cascades if that is possible. So those kind of things we advise. And the last, in admission, so we have medications, we have injections, we have even a new injection called ketamine which is available, which is the fastest anti-suicidal agent. We also have ECT, electroconvulsive therapy. People might be a bit irky about it, but that is the safest and the fastest acting. So these are the options that we have, and if at all a person comes for professional help, we can offer them all of that.
Ma'am, just you mentioned about the medication, the admission, and after the procedures that follows, the injection, as you said. So as you talked about the suicidal wave, so is that medication helpful to the child only, once the suicidal wave is done, and in the future, if it returns back, if the child or the person again feels suicidal, so does it impact the child or the person?
What happens is, usually when we talk about suicide, so there is a background psychiatric condition that usually runs, most commonly depression. So when it is severe depression with suicidal ideas, there the ideation comes in waves. We give medications for the depression part, right? And for the suicidal part, we have the other strategies that I talked to you about. Once the depression is better, it is expected the suicidal ideation will not come. So that is how our medications work, right?
So, ma'am, my last question to you would be, seeking help for mental illness is still a luxury, and especially for the people who are struggling with mental illness in the rural areas. Because they do not understand what mental illness is, they kind of go to follow any kind of superstitious that, they blindly go and follow that. So do you have any instances where you have patients coming from the rural areas without any awareness about the problem, the sickness? So how do you handle such cases?
Yeah. So in the rural areas, as you rightly said, so they don't present to us with only depression or anxiety. They present to us with a suicide attempt, and like God's grace, the child is just saved. That is the condition where we usually get a referral. So here what we do is we try to prevent further damage, right? But definitely the deeply ingrained cultural practices, like if a child is not reading, they will go to a gunya, yeah, and the child will be exposed to those burnt iron rods and get multiple burns all over the body, but they will not come to a doctor because they believe some witchcraft or some kala jadoo has happened. So definitely that is a big barrier. So but what we can do is we can talk in their language. You can continue doing whatever you want to do with the gunya practice, but please continue our medications in addition. So that might be of help. Medications work better with rural background people because they don't understand the psychological model or the role of counseling at all. So we have to provide them medications, and that is why we have to admit them. There is no other choice, because we cannot educate the parents and cannot trust them enough because they are not able to understand the deep implications of it. So definitely you're right, rural and urban, the way they present to us is different, and the way we approach them is also different, because here we offer a lot of psychological options, therapy and all that, but here medications are the only route we have to resort because they don't understand anything else.
Thank you so much, ma'am. It was a great conversation with you. Any last words, ahead of World Health Day to our audience?
Okay, so World Health Day, there is no health without mental health. So I think talking about mental health is what breaks the stigma and starts the journey towards recovery. So start talking, take time. Lives do matter. You can save a life, save a suicide. So that is what you can do.
Thank you so much. Stay tuned to Orissa Post Live for more such updates.